Please help me welcome Dr. Catherine Donnelly to the stage, and her talk is Neighbours Helping Neighbours to Age Well at Home.
Eleanor Rigby died in the church and was buried along with her name. Nobody came. All the lonely people, where do they all come from? I'd heard that Beatles song countless of times, but it wasn't until I went to a talk on loneliness that I really listened to those words. An anthem to loneliness. Eleanor Rigby, I want you to pause for a second, and I want you to think about your neighbors, your families, your friends, maybe your coworkers. It is almost certain that you yourself know your own Eleanor Rigby. Or maybe you are one of those many lonely people in the world. I'm an occupational therapist and health services researcher here at Queen's University. And I want to share a story about a man I will call Frank. I got to know Frank about 8 years ago working at the Queen's Family Health Team, and I was asked to see Frank for home safety. Frank was 85 and had a number of chronic conditions that made it difficult to do the activities that he needed and wanted to do. He had difficulties getting in the shower. He had trouble standing, making it hard to make meals for himself. He had difficulties walking around his neighborhood. Frank lived alone in an apartment. He knew only his neighbor next to him. His wife had died a number of years ago. Frank loved to carve wood. He had a whole room in his apartment dedicated to his wood carvings. However, money was tight. It impacted not only the activities he could do, but the food he could buy. He had one living relative who lived about an hour away, who would occasionally come down and go to health appointments with him or help him with some of the heavy activities around his apartment. Frank was both lonely and socially isolated. Loneliness being a feeling we have, social isolation being the number of connections. Loneliness. It's been described as a global health issue, the next public health crisis, an epidemic. We don't know the exact magnitude of the problem, but studies suggest that 1 in 3 people are feeling lonely. And it's likely that a number of you might feel that way or one day will feel that way. We know that older adults are particularly prone to high and chronic levels. Our research and that of others has suggested that over COVID, loneliness has increased. Consider we now use the word social isolation as a household term. The impact of loneliness on our health is actually startling. The risk of an early death, if you're poorly socially connected, is the equivalent of smoking 15 cigarettes a day. You really can die of loneliness. Humans are wired to socially connect. Consider that we use solitary confinement as a form of punishment, torture even. However, our society is less socially connected than ever. And older adults are living alone in higher numbers, in part because our population's aging, but also in part because of social changes. And I recognize that loneliness impacts all ages, but today I'm going to share a story about loneliness as we age. And so while I saw Frank in his apartment, I actually also saw Manuel and Lee and Tilly. And each had a number of different issues, but fundamentally each were also lonely. And so when I went to see Frank in his building, I would see Lee on the first floor, I'd see Tilly on the second, and then I'd take the elevator up and see Manuel on the third. And then I'd go around the corner and see Joan in a house on her own, in a neighborhood that used to be filled with families, but now was a street lined with homes with older adults, each living on their own. And what I really wanted to do was connect Frank to Manuel, to Lee. But as a healthcare provider, maintaining confidentiality is the core to the professional relationship. I had tried to set up a few community activities and invited them, but mainly without success. So I continued to provide services individually, I didn't really have an intervention necessarily at my fingertips. I knew them, but neither of them knew each other, all living alone under the same roof. And so while there's been a lot of focus about describing and understanding loneliness, much less attention has been paid to what we can do collectively as a society, as healthcare providers, as people. We know that loneliness shortens lives. The Harvard study on adult development looked at 268 Harvard sophomores, men, and they followed them since 1938. It's one of the longest running studies. And what they found was that relationships are protective. They found that men who reported satisfaction with their relationships at 50 were the healthiest at age 80. Taking care of our relationships is literally taking care of our health. The UK has a ministry of loneliness dedicated to creating a connected society. Denmark has a movement called Denmark Eats Together. In Canada, we've had targeted funds, but no movement, so to speak. And so while Frank, what he really wanted to do was stay in his home, age in his neighborhood, and he wanted social connections. But fundamentally, when we think about how we support people, we think of people individually. We don't think collectively as neighborhoods or communities. And so while we worked as our primary care team supporting Frank, we were able to deal with the tipping point issues. We kept him at home safely, but fundamentally we weren't able to address those issues I spoke of earlier, isolation, loneliness. We simply didn't have the tools in our collective toolkit. So I'm an associate professor at the School of Rehabilitation Therapy at Queen's University, and I was teaching a course in our Aging and Health program called Evaluating Age-Related Services and Programs. And one of the key assignments is that the learners go out and identify a program for older adults in the community. They spend the semester learning and describing the program and developing an evaluation plan. And I remember one year I was reading one of the assignments and I came across a program called Oasis Senior Supportive Living, or Oasis for short. And as I was reading the assignment, all the pieces came together for me. And I immediately thought of Frank. For Oasis is about bringing people together in the neighborhoods they live in to address issues of isolation and loneliness. So myself and my colleague Vince, also at the School of Rehab, we called Christine McMillan, who was the founder of Oasis. And she graciously invited us over for a pot of tea, and she explained to us what Oasis was. What we learned was Oasis was founded here in Kingston by a group of older adults living in a naturally occurring retirement community. We call it a NORC, affectionately. And NORCs are gaining a lot more attention, so you'll start to hear that word after this talk, I have a feeling. NORCs are, again, just a geographical description of an area with a high proportion of older adults. So they're not an intentional community, they're really naturally developing, as the name suggests. So for instance, it might be an apartment building that older adults naturally move to that's close to amenities, or it might be a neighborhood like Jones, for instance, that used to be a young families that all age together. And again, on their own, they're just simply a geography, but they hold great promise to think about how we might support older adults. So we might think about how we could bring older adults together living in NORCs, or bring programs or services to communities. Oasis has 3 pillars: nutrition, physical activity, and socialization, all done in groups together. The core tenets of Oasis, our core beliefs and values, are self-determination and empowerment. This notion that older adults know themselves best, know what activities they need to support themselves. And so Christine and the older adult members of Oasis went to our local health network at the time, and they were able to secure funds to hire an on-site coordinator to come to the building to enact the programs and activities that the members themselves identified they wanted, that funds are still in place today. Oasis isn't a health program, but it has potential health outcomes. And so, as I was listening with Vince to the stories of Oasis, I immediately thought of how could we offer this to Frank in his building? And we thought, how could we bring this to other communities across Ontario? So began a process of trying to secure funds to do that. And in 2018, we received just over $1 million to do so. And working with our partners at McMaster and Western, we were able to expand to 5 communities in Ontario. Now, during that time, Frank continued to decline. And by this time, he had stopped doing any of his wood carving, and loneliness and social isolation were constant. I remember that summer after we received the funds, we spent the summer going to the original Oasis and listening and learning to try to describe what those core ingredients of Oasis were so we could bring those again to those other 5 communities. We had a group of students with us and who mapped all the NORCs out in Kingston and across Ontario. And we started to identify what buildings might be a good place to have Oasis. One of those buildings we identified was Frank's. So we called up his landlord. And again, Oasis is a partnership with landlords, and that could be a not-for-profit, a profit, a social housing building. And they offer space, in-kind space, to run the program in their common room. And when we called Frank's landlord up, he said yes. And so that's when things started to change for Frank. Oasis is about building communities where people are living. So we literally put flyers under the doors of all the residents in Frank's building. We put posters on the walls, in the lobby, in the laundry, in the elevators. And then we held a series of information sessions to gauge the interest of people's, if they were interested in having Oasis in their building, and what sort of activities that they would want. We put a lot of pots of coffee on, and we put pot of coffee on in the lobby, and we sat and we listened, and people came and started to talk. Now, I went into this whole idea thinking, if we build it, he will come. But I, in truth, didn't know if Frank would come to those sessions. But I remember it was a cold October, we opened the door, and in came Frank to one of those first planning sessions. By then he was using a walker, and he sat in the corner on his walker, not knowing anyone in the room, for he only knew his neighbor by name with no real connection. Over the course of that year, Frank had a community. He would enter the room and would be warmly greeted. He started coming 3 mornings a week for coffee and newspaper chats. Once a week, he would go to the art drop-in program and bring his carvings. And by then, he was actually teaching others to carve. Frank, by that time, was 90. He had lost his license, but he had had a community around him who would drive him to where he needed to go, who would call him during the week. For Oasis is about building the network and your services where you're living. It's not about delivering a meal to somebody who lives by themselves, who then eats alone, or hosts an exercise program across the city where you drive to only to come back by yourself. It's about bringing those activities and programs into the building and neighborhoods where you live. Building social networks by engaging in activities that you design yourself so that you can help others and be helped yourself. By 2020, the pandemic hit, and we were immediately concerned how Frank would manage the public health restrictions. Again, Oasis is not a health program per se, but we knew we could mobilize our community. And so I remember we had 2 occupational therapy students working with us at the time, and they immediately developed a calling list. And they were calling members every day at first, seeing how they were doing. And I remember Simone Parniak, our amazing project manager, spending hours working with Frank on his extremely slow computer, teaching him how to use Zoom, which he did. We started out wanting to see if we could expand Oasis to 5 communities, which we did. But part of what we wanted to learn was, what was the impact of Oasis on isolation, loneliness, health? We conducted a series of interviews with members of Oasis in Frank's building and a number of the other Oasis communities as well. And what we heard were three core themes. The first was something to do, someone to do it with. We heard Lee tell us that she liked to go to Oasis on Monday mornings for coffee for about an hour. It helped her from being stuck alone in her apartment. It gave her a reason to get dressed and put on lipstick. We also heard a theme that was about helping people cope with life a little bit better. We heard Manuel tell us that it gave him a reason to think of a better life for himself. And the last thing we heard was building and strengthening social networks. Over and over, from people from all of the different communities, people kept saying Oasis was like a family to them. And for Frank, Oasis became his family. Shortly after the pandemic, Frank was hospitalized. During his hospital stay, he received calls every day from the community. Frank passed away after a brief hospital stay, not because of COVID. Having been connected and been able to live in his home until the day he went to the hospital, just as he had wanted. And like Frank, older adults resoundingly want to remain in their home. They want to live in their own neighborhoods. Part of what we've been looking at to see if can Oasis help with that goal. And what we found was that Oasis members in Kingston, if they did go to long-term care, they were able to stay in their home for 1 year longer than older adults who lived in a building without Oasis. We also found that Oasis members, or older adults living in Oasis building, were less likely to go to the emergency department, less likely to have hospitalizations, and used fewer home care services. These are just some of our preliminary findings. We've been extremely fortunate because we're currently conducting a 4-year longitudinal study supported by the Canadian Institutes of Health Research. What we're doing is we're looking at social networks in each of the buildings, and we're looking at how those change and develop over time and how they influence both health outcomes but the use of healthcare. We've also received a generous gift from a donor, and we're currently in the process of expanding to 5 other sites. And so what became and started here in Kingston at one building with 50 members is now a growing network of 11 communities, both here in Ontario and now also in Vancouver. So our focus is really thinking about sustainability, thinking about a way to sustainably keep our network going, and also to think about how we can build a network across Canada. The irony is not lost that I am standing here alone on stage as I talk about communities and connections. But I am not alone. I have done this work together with my colleague Vince DePaul here in the audience here, and I'm just so grateful for him, and Helen Cooper, the president of the Oasis board. And together, I can say that it's a once in a lifetime gift to be able to work with people that you just get up in the morning and are just so happy to see, doing work that's changing lives. And it's with gratitude that I thank the entire network of researchers, partners that we've been working with. I started today talking about Frank and loneliness. There's no expensive test to diagnose loneliness. There's no expensive pill or surgery to fix that feeling. But we are actually, together, can change how we look at the world and change how we address and support older adults. We can work together to build connected societies, starting with the neighborhoods we live in. So I'm going to get you to think of that person that you thought of at the beginning. And I'm going to offer you the opportunity to, as you leave today, reach out to them, call them, or better yet, pay a visit. It literally is the gift of health. Canada too can start a movement, and it can begin here with us today. Thank you.